Hi, this is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. Today, we're going to talk about what a non-surgical facelift actually is. The reason why I make this video because there's a lot of confusion, and that has to do with a lot of information that is out there that is unfortunately misinterpreted about what a non-surgical facelift actually is. I know it sounds very sexy, very enticing, very attractive. Anything with non-surgical in front, sign me up. The question you have to ask yourself first is, what is it? What is it based on? How is it done? And most importantly, how long does it actually last? We all work hard for our money, and we want to spend it well. And we want to get the most value out of any dime we spend. At least I'm like that. I don't know about you. So too many patients, they get so excited about the word non-surgical that they don't even ask any questions. And it's shocking to me because I know how hard everybody is working for their money. And the last thing I want to do is waste people's money. Call it pride, call it passion, call it ethics, call it whatever you want. It's so important to me, and I want you to listen very carefully to this video, because there is not a day in my office where I have a patient come in that has fallen victim to one of these gimmicky things and spent thousands of dollars 2 months ago and has absolutely no results. Worse even, looks actually worse than they started off with. It makes me very emotional and upset, and I decided to make this video to clarify several myths and to also tell you what actually does work based on science, based on experience, and you will also be able to see some before and after pictures that you can see for yourself and be your own judge. Okay, so we're also going to do a little bit myth busting, okay? So what is a non-surgical facelift? Again, if you've watched my video on facial aging, where I've in detail described how the face ages, you will understand what's going on with your face when you look in a mirror. At any given decade, in your 30s, 40s, 50s, 60s, different things happen to the face. In general, to recap, the face ages from top to bottom. So first we see the eyes aging, brows drooping, the mid-face drooping, and the lower face and the neck. So the most common patients that come to my office are actually in their 30s and early 40s, okay? I rarely see patients coming that are in their late 50s or 60s or 70s. That was like 20 years ago when I started. Today, most patients, again, are 30s and 40s, and the most common complaints are eyebrows, doc, can you lift this up? Or can you lift this? They point to their mid-face. And then the ones in their 40s, they talk about, I want this. So all these things that I showed you have to do with lifting, meaning we have to defy gravity somehow. Now, quickly before I talk about how to do this, I want to do some myth busting. What cannot defy gravity? Number one, gel, okay? Something that's like gel, which is our fillers that we inject in the face, can't defy gravity. So non-surgical facelift, a lot of people use that term as a substitute for filler because it sounds more enticing and more attractive. It's really kind of not right. When you inject filler, you're filling, right? That's what the word means, fill. So you don't really lift anything. You can't hang your face with the gel. It's kind of like hanging your picture on the wall with a chewing gum or with Jell-O, okay? Jell-O doesn't hold your mirror on the wall, okay? You have to put a nail or something. So it makes sense, right? Because gravity is pretty strong. So when you inject fillers, all you do is you're filling. So you're increasing the volume, okay? It's like when you have a flat tire, you put air in it, your tire looks bigger, okay? But also the rubber looks tighter, okay? It doesn't look as floppy anymore. So you can do that, but what you need to understand is that you're changing the volume, and with that, you're changing the shape of your face. Very important. You're changing the shape of your face and the size, okay? So you will look different. So you have to be very careful. A lot of celebrities have come out and said that they overdone it, and they had actually all their fillers dissolved. By the way, I'm not demonizing fillers. I use it in my practice a lot, but for the right patient, and usually for patients that actually need volume, not to lift the face, but where you have volume deficiency. And we're talking about this in a separate video. So when you lift the face, you need something to actually lift it as opposed to causing another problem or creating another problem. So what avenues are there? So how can we do this? So the only way you can lift something is if you shrink it, right? I mean, just like your shirt. If I shrink this shirt, it's going to look tighter on me, and my body, the contours of my body are going to become more obvious, okay? I haven't changed my body, I just shrunk the shirt, right? I didn't grow muscles, of course, that's one way, but let's talk about that I'm not changing my structure, I'm not changing my bones, I'm not growing anymore. I just want my structures, my shape to show more obvious. Pretty much, I want to look buffed, right? So all I have to do is, this is a medium-size scrub shirt, all I have to wear is a small size one. So I just shrunk my shirt. So today there are technologies and techniques through which we can do that. However, only to the skin. So if the skin is the problem of the droop, that today, with today's technology, can be addressed. And like I said in my facial aging video, if the muscles and the fat start drooping, you can't counter that or reverse that by tightening the skin, because the skin can't pull the muscles up, okay? They're separate layers, okay? The good news is, in the initial stages of aging, what starts drooping first is the skin, because we lose the elastin fibers, collagen. Starting in our 30s, every day we lose collagen, and our skin is made out of collagen. So imagine you lose collagen, and the elastic fibers, which is what keeps your skin kind of tight and healthy looking. When you lose that, your skin will kind of lose its smooth texture and start looking like wrinkly and little saggy. That's the initial stages of aging. For that, there is a solution. Today, we use the radio frequency devices to counter that. Now, there's many out there, and they have different pros and cons. But anytime you spend a lot of money, you want to obviously use the best device to get the best result, right? And these technologies literally change every year. So if you've heard about a technology a year ago or 2 years ago, there might be actually something better today. Well, some patients say, well, in that case, I'll just wait for next year. But then how long are you going to wait? When are you going to say, okay, I'm going to do something about it? Well, the answer to that is when you're thinking more than 2 or 3 times a week about it. That's the time to do something. It's kind of like, when am I going to get the new iPhone? I think it just came out yesterday, and people are like, okay, should I upgrade? Shouldn't I upgrade? It's the same thing. It's whenever you feel it brings you more value and it makes you happy. So what the radio frequency devices do, they essentially use heat, and that's been used in medicine for a century. We use electrocautery to shrink tissue or cauterize bleeding, which is basically we touch the tissue with an appliance that produces heat, and that will just shrink tissue. So technology has helped us to do that safely, because we don't want to burn the tissue, but we want to shrink it to the point that we get the result. And there are devices like NeckTite, FaceTite, BodyTite. They use a bipolar probe that bipolar means it has 2 probes. One is on top of your skin and one goes underneath your skin, and your skin is basically sandwiched in between, and heat will flow to both probes, and whatever is in between gets exposed to that heat, which you can dial and control using a computer. And that's based on science and research that has shown the safety as well as efficacy. And based on the heat introduced to the skin or to the tissues, it will shrink it. And when it shrinks it, it will make it like your shirt from size medium to size small. So everything will look tighter, okay? So that's all it does. And that actually gives the appearance of a lift because you're actually, by shrinking it, you're lifting things. You're changing the composition and the biology of the skin and the collagen. Better even, these techniques and these technologies, they also promote new collagen growth, which is the very thing we start losing starting in our 30s. So that's its long-term effect. Of course, once we boost the collagen production, based on our biology and DNA, it starts going down at some point. Usually it's after like 6 months or a year, it starts going down. And at any given time, we can replenish that. So we can keep it at the steady state. And that's called maintenance. Just the same way you cut your hair, the same way you brush your teeth, the same way you trim your nails. It's basic maintenance. It depends on how important it is to you. So a lot of patients ask me, well, how long does it last? Well, it depends on a lot of things, like I mentioned in previous videos about your lifestyle, which is diet, sleep, stress, and health. Okay? Those are the most important things. And then also the age at which you have done this procedure. So this is something for patients in their 30s, early 40s. Once you hit the age of 45, it's very hard to lift things non-surgically. Why? Like I explained, at that point, your muscles and the deeper layer of your face start drooping. And those can only be addressed through surgery. And for that, watch my facelift and neck lift video where I explain exactly how it's done. Which brings us to the next question is, do I eventually need a surgical lift if I do a non-surgical? Of course. Because you're not going to stop aging. We're not going to stop the clock. We just turn back the clock. Once we turn back the clock, it keeps ticking, okay? And you're just going to look better for your age, or you're going to look the way you feel, As more of us are going outdoors and thinking about health, fitness, and just improving lifestyle, we feel much better. I mean, today's 50s is like yesterday's 40s, sometimes even 30s, because we're living healthier, we're living longer, we understand more about what we can do for our health. And when that doesn't coincide with the way we look when we look in a mirror, it bothers us. And that's why patients come to us. They say, I look much older than I feel. I want to look the way I feel. And that's really why we're doing all of this. Make you how you feel, not look like a different person, or not make you look like you're 20, okay? That's not the purpose. The last thing I want to leave you off with is that a lot of patients ask me, well, how's the recovery? That's a very important question for most of my patients, especially in a fast-paced DC area here. You have to understand, these are non-surgical. So what really dictates the recovery is a little bit of swelling. There's no bruising associated with this. And the swelling is really limited to like 24 hours. So really the recovery for all these face tightening procedures using radiofrequency devices, specifically the one that I mentioned, which is today the best one. It's made by InMode. Is that it's really 24 hours. You could go to work the next day and no one will actually know. These procedures can also be combined with others like fat removal, like liposuction. And liposuction of the face and the neck is nothing close to or similar to liposuction of the body, which is a little more involved. You could have a liposuction today and go back to work tomorrow. There's pretty much, I don't call it even recovery. It's like a one-day downtime. And that can be combined with removing fat and tightening the skin so it doesn't sag. Very common procedure for patients in their 30s and 40s, anywhere to mid 40s. And those give you results that will last for as long as you stay the way you are, meaning once the aging continues, average studies have shown they last about 5 to 7 years. Because why 5 to 7 years? Well, let's say you did it when you were 40. At age 47, the sagging of the muscle and the skin has continued and gotten to a point to where you started off. That's that's why we say it lasts X, Y, and Z amount of time. Basically, at what point are you going to look the same as you looked before the procedure? That's how we measure. Hopefully that little explanation helped, because it's the most common question I get, and it's the most common question you want to ask when you spend your money on your facial rejuvenation. Because the most important thing to me is your face, your result. Your face is my reputation. And hopefully this video helped you to give you a little context and perspective about what to look out for and what procedures to choose. And like anything else, you want to choose a doctor that has done plenty of these procedures, has a lot of experience, and is at the forefront of science and technology, or else you might get an outdated procedure that you might be very disappointed with. So do your research. Don't jump quickly on something that sounds enticing or attractive. Get several consultations, and there's a lot of information online. My job is to wrap it up for you, give it some context so you understand what you read and see out there. Thank you very much. This is Dr. Daria Hamrah, facial cosmetic surgeon, Washington, D.C. Have a great day.